So our keynote speaker this morning is Dr. Ed Weeber. We heard from him yesterday about Therapeutics 101, but he's going to really put a different spin on it today. So as you know, Ed started in academia at the University of South Florida, well, other places before that, but that's where we met Ed as part of the Angelman community, and developed a gene therapy for Angelman syndrome. And that was the first gene therapy to ever be published, actually. And that really set the stage back in 2011. That work started in 2008, or maybe earlier, which really was ahead of its time in many ways for a rare neurodevelopmental disorder where there were really very few concepts of gene therapy at that time. And that was really the impetus when we saw that you can rescue phenotype in an animal model with a therapeutic that was entering the brain and returning the gene that was missing. That was novel. And that was something that made us realize that there was potential to transform lives. And we needed to get this out of the mouse and into humans. And when Ed then transitioned that program into industry, it was a real step forward to say, we're gonna really move Angelman syndrome forward in a really positive way. And we're really excited. He's gonna talk you through his story, but we're really excited to have Ed back into the community and working for all programs for Angelman, not just a gene therapy, but he's now heading research and discovery at FAST, and that has been such a blessing for us to have him join our team. And so with no further ado, Ed, take it away.
Good morning. So just to expand a little bit, because I didn't really talk about my journey too much yesterday, because I think it's more important to talk about it today in the context of the talk, really about industry as well. So yes, I started out in academia. I went through the same academic pathway that a lot of professors take. I did a postdoc. My postdoc was at Baylor College of Medicine. I started in an innovative lab of Dave Sweat. He was in the Division of Neuroscience, and right next door was a different Department of Molecular Biophysics and Genetics, and that was the department that Art Beaudet was in. He was the chair of that department, and that's when they discovered the AS gene and made the AS mouse model. And so that's how I got involved, was just kind of the location that I was in, and working with Art in his laboratory on AS. Now, I transitioned to Vanderbilt and then went to the University of South Florida. And at that, we were doing work in that area of gene therapy. Very, very new at the time. I mean, yesterday you saw these innovative programs. That was really innovative at the time. And I'll tell you, I did that initial study with a grant for $23,000. So don't think that your contribution or the money that's needed to do innovative research has to be millions of dollars. I did that for really very, very little amount of money. That technology was patented. I had a lot of other licensed work that was patented through the university. You have to remember, when you're an academic, the research and the patents belong to the university, not the professor. But that was licensed to a small company, and then that company got picked up by even a larger company, and they were really committed to take that gene therapy and bring it into patient. And so I quit my academic position and I went to work for that company for 5 years. And unfortunately, it was one of the companies that Allison showed had dropped their programs for a number of reasons. So I thought about, you've seen a lot of the innovations, and I thought about how to kind of design this talk, and I want to bring you through what is involved in that pipeline. And I kind of showed a little bit of that pipeline yesterday. And I know you've seen, so my transition, I know you've seen this graphic before where it talks about therapeutic development and how it's really daunting process to get that initial therapeutic development all the way to the patient and FDA approval. And it is tough, and there's a small percentage that actually make it. But on the left side of that graphic, before therapeutic development is all the discovery research, and all that usually happens at the university level. So I'm going to kind of bring you through how that innovation starts. You heard a lot of innovation yesterday, programs that we would never even dreamed of 15 or 20 years ago, that are being pulled through, but most of those start at the level of the university. But I want to show you an interesting graphic, and I didn't make this up. This is actually a real thing. And I have this titled, "Where Do Therapeutics Die?" And there's a lot of therapeutic programs that never make it to the patient. And there's a lot of reasons why. And I'm going to kind of bring you through this. But at the beginning of this, I just want you to look. So there's resources on one axis, and then there's early discovery research, therapeutic development, and then clinical development on the bottom, right? So as these programs start to progress, you need more and more resources. And so that innovation starts at the university. And what happens after time is that the university professor or whoever started that innovation, those resources start to go down. And so at some point in time, sometimes industry picks that up. And industry sometimes will pick it up at places like, they can get it from a journal, from a publication. They can get it from a PI talking about it at a conference or a poster. And so a lot of times industry will see these innovations and say, oh, this is something that we can bring in and we can put resources toward. But there are a lot of reasons why an academic at a university cannot take that all the way through to clinical development. Experimentation becomes really expensive over time, right? So the more that you expand this and the more that you start doing things like target validation and expanding targets and optimizing whatever that therapeutic target is, those becomes really expensive experiments to do. A lot of times you need more sophisticated tools to do it. You may need a $500,000 microscope or a $100,000 experimental library. Some academics run their entire laboratory on $100,000. They just can't afford to do that. And then the last thing is that a lot of times you need guidance. If you're working on a small molecule, you need medicinal chemists. You need a whole plethora of other people that industry have that you just don't have access to as an academic. There are also other pressures on academics. And I talked to somebody who was working in they were a parent of a child that has a very ultra rare disorder. And they asked me, well, how do you get academics involved in that disorder? And really what grants do is it buys the academics time, right? So any academic they're pulled in many different directions. They're training students, they're teaching, they have departmental responsibilities, they're giving talks, they're writing grants a lot of the time. Many early hours I spent writing grants to several different places just to get money to run the laboratory. So any grant that academic gets, it buys their time to concentrate more on the science, expand their research, expand the number of people they have in their laboratory. It's really what we try to do, right? The term publish or perish, I know you've heard, and it's totally true. You can't get promotion, you can't get tenure unless you're actually publishing papers. And the better the paper, that's your product, right? We run our labs kind of like small businesses. We have payroll, we have overhead, we have animal costs, and really our product is the science that we produce and where we publish it. And if you're doing things like target validation or you're working through multiple libraries, that's a lot of negative data and it's a lot of work, and you can't publish that work. So this is where this resource starts to fall off and where academics can only go so far. Partnerships with industries aren't always supported either. If the IP is there and there's still discovery that has to be made, universities are really skeptical about industry partners coming in and helping that academic. So there really is a rift in this valley between where the university starts and where industry kind of picks up. Now, I've been on both sides of the fence. So I was an academic for a number of years, and then I went into industry, and it was an eye-opener on the pressures of industry as well. So industry finds these programs, these innovative programs that the academic is doing. They may pick up those programs, and the first thing they do is they say, well, we need KOLs. So what is a KOL? A key opinion leader. These are usually the university professors that made the discoveries. So they pull that expertise in because the professors have the expertise, they have the resources, right? And all the personnel to bring this forward. They analyze disorders at multiple levels. And what I mean by that is that even if there's a platform that looks good, it may be innovative, it may be a great target, they'll look at that disorder outside of the science, okay? And especially with a rare disorder. If it's a rare disorder that doesn't have a good registry, where are the patients? If they're going to bring this to a clinical trial, they need to know where the patients are. Is there a good natural history study? If there isn't one, they're going to have to pay for one. So industry looks at all of these things, and this is something that FAST has been involved with years and years of putting in input and your input as well, and your help to get a registry started, to get a good, solid natural history study. Allison talked about that yesterday. These all make Angelman syndrome that low-hanging fruit that Allison was talking about. It makes it very attractive to industry as well, because they don't have to replicate that and they don't have to produce it on their own. You've already done that. FAST has already done that. There's also a speed to be first, right? So when I went into industry, I was told, oh, well, they're kind of fast and furious when you get in there. I had no idea. But let me tell you, industry science is done at an extremely high level. There's a lot of people scrutinizing the data. There's a lot of experimentation that gets done. And any kind of industry work that's done, it's going to go into patient. So it's done at a very, very high level, and it's done very, very well. I was very impressed with the science that's done in industry. But there's no trophy for second place. So industry works really quickly, and speed and time is really their priority, not money. Another thing that I learned when I was working in industry. So there's industry decisions that come into play for any program that may get killed. There's financial constraints. I think Allison talked about some of those yesterday. Regulatory approval, if they don't think they can get it past the FDA, why continue with the program? Market viability, is it going to make money for the company? Competitive landscape, if you're a small company and a larger company comes in and starts doing the exact same thing, it's tough to keep that program up and running. Unmet need versus market size. You may have a great product, but if it's an ultra rare disorder, it's only going to fit into a few people, that return of investment is never going to be seen. There are scientific and technical challenges. We talked about the blood-brain barrier yesterday. Sometimes you can have a great therapeutic, but if it's too invasive to get in, they may kill that program. And then patent and IP issues, and that's always on the forefront. Do they have a strong patent? Is that patent going to last long enough for them to get their return on investment? These are all business decisions that have to be made. There's also industry decisions that can not be anything to do with science or scientific viability of the program. Strategy and focus changes. They're a business. Sometimes this happens. Shifting priorities. They may shift their priorities from research and discovery to something else, maybe product acquisition. Changes in market conditions. This is probably the reason why many of those companies that Allison showed yesterday drop their programs, just because of those market conditions, and that it's very cyclic. And they'll go through places where, industry will just hire a lot of people and they'll be going really great, and then they'll go through this cycle again. And something as simple as a leadership change within that company may redirect where they're going with their work. So when we look back at this graph, this is where FAST has really come in, and this is where they've been doing this work for a very long time. The innovative research that I did way back in the day that you saw yesterday, this was initiated by FAST-funded projects. They bought that research time, right? They gave the money to do those innovative things. The work that was done by Scott Dindo and the FIRE team, all that was FAST-funded. They bought the time of those researchers to really spend more of their time thinking about therapeutic development and how we can get therapeutics into patients. All right, and FAST has been very good at that. And this is where it doesn't take millions of dollars of funding to do this. It takes enough funding to get that academic to look and change their programs so that they're focused on AS. How do we bridge this valley of death? It's a big question, right? So there's only so much that a single person in an academic laboratory can do. Well, this is how you do it with AS2 Bio. And I hope that this graphic really keeps in mind the importance of having that accelerator and that incubator. So now we have all the places, everything in place, right? We have the model. We have the innovative research going on, and some people say, well, why are you here, Ed? Well, this is why. I know what it's like on the other side. I know what industry is like and what they're looking for. And so I can help guide that early research and that early research discovery so that it's geared toward bridging that gap, that valley of death through AS2 Bio, so that academic research and innovation can get handed over into industry. It's really important, but this is a great model, and this is why other people are looking at FAST to say, how do you do this? How do you cross that valley of death to get those innovative research programs into the patient? And we figured it out. Allison and Julian and Ryan and Jennifer, they've figured this out, and this is what they're going to talk about today. And then, I don't have a slide at the end, but I want you to leave this knowing that industry is not the bad guy, right? They're not a nonprofit organization. They are a company, and they have to make company decisions. And I don't want to leave you with the idea that they're really the bad guys in this whole process. They really aren't. And I know there's going to be a lot of company people that come up here that are going to be representing their companies, the very large pharmaceutical companies. They should be applauded. It's hard to impart the amount of resources and time and money and energy that goes into any program that industry picks up. It's immense, and it is impressive to see. And I've been on the other side, and I've seen it. And I think that the people that are going to come up here, they should be really applauded for keeping up and doing what they do from that industry perspective for you and your kids. And with that, I'll hand it over to Jennifer. Thank you very much for being here.